I could walk on water, I still drown in you.
Welcome to another video, everybody. I am Dr. Leanna, owner of Chiropractic. This place is a mess. It's a freaking mess in here. Just finished up with a client, but I am gonna show you guys how to treat someone with neck pain, and we're gonna do this with B-Dog sitting up instead of laying down, so I can dig into the traps a little bit and have them do some flexion and extension with stripping the muscle. So welcome to the video. Hope you guys enjoy it. Give it a thumbs up, subscribe if you are not already, and we will get into it. Here is our model patient. Take a seat, sir. Okay, sit up straight for me. You can already see we did some cupping on him a few days ago. Look to the side, turn your head that way. Okay, go the other way. So we're a little bit restricted going to the left, then flex down for me. Okay, and then come up, look to the ceiling. Okay. Alright, so we're basically going to clean up stuff through here, through the traps. And now if I were to do like a full session, we'd get more into like the pecs and stuff, but I'm just going to show you simple neck treatment. How does this all feel? Tight? Mm-hmm. Yeah? Okay.
Kind of restricted because I feel the knot not letting me.
Through here?
That rib might be out of place or it's really badly knotted up.
So usually I start with a little bit of Graston just to dig into the tissue and find where the restricted areas are. And then we're actually going to come into his rhomboid through here too.
The view from the back of the room. I wanna change my name.
So you can see pretty much where the restricted or troubled areas are. Like right through here is this problem area, but there's just, you can tell there's just a bunch of scar tissue through right in there. So then we'll move on to just a little bit of cupping across the traps there. And I usually always start out with the sliding cups just to help kind of pull up the skin and get blood to the area. And it's a little bit of a kind of like a transverse massage. There you go. Okay, I'll look back up. Okay, then look slowly down again. So a lot of times when I'm doing muscle work, most of it is active release stuff, so that means that the patient is going through ranges of motion, usually with the action of a specific muscle that I'm going across, so that you're stripping the muscle while they're going through that range of motion. I think it's a lot more effective than just a regular massage. So like most people, he's pretty tight through his scalenes here. So a lot of times I'll go across this muscle while I'll have him look in that direction, then come back up, and then do that again for me. Yep.
Because it's lonely living in them, always living in them. Now I'm laying down, yeah. Tired of the place I love, and I'm tired.
And then I'll usually always use the hypervolt just to save my shoulders. And then while I work on the right side, I'm going to put some stationary cups up on his traps.
Trying to fit in cause I'm losing my own youth, and I ain't giving you up, I'm never giving it up.
And then I usually let the cup sit for like 10 or more minutes to get the best effect. So you can see through there, got pretty red. So then I'm just going to do one more muscle technique and then get his neck adjusted as well. Okay, so you're gonna flex down first at the neck and then, yep, through the spine. Flex over a little bit more. There you go, there you go, there you go. Okay, come back up. The same thing. And so the last thing that I'm doing is stripping these muscles that surround his spine while he's flexing, kind of one vertebrae at a time. First I tell him, come up and flex through the neck. And then he'll go through the thoracic spine. Okay, so I'm going to show you guys too his range of motion. So look to the right for me. And then look to the left. And so we got that to improve by quite a bit, so that looks good. Shoulders drop. There you go, a little bit.
Mm-hmm.
Good. That was a good one. So that one is mostly for the CT junction. So like, we got quite a few on that one actually. So like C6 through T1, T2. Okay, and then flip to your back. So he is pretty locked up on this left side. I'd almost say like C5, C6. And then a little bit higher on his right side. So usually people ask like what am I looking for when I'm adjusting the neck, and it's usually motion. So I'll go through the cervical spine and see what segments are moving and which aren't. So for him it's just like, alright, so my camera died right before I adjusted this side. But we got quite a bit on this left side. And now for the right, it's a little bit higher. And actually for his size, as big as he is, how hard it is to adjust like his thoracic spine, his neck is probably the easiest thing to adjust. And there wasn't really a whole lot on that right side. Usually you can tell when it's just going to adjust nicely, but there's just a little pop. And then lastly, I'll usually do a little bit of distraction. Not the ring dinger, but just a little bit of a pull here. Then lastly, we're going to do the occiput adjustment. And I don't do this on everyone, but he is a person that benefits from it. So look this one for me. that's so much better. Okay, come back this way. And since I don't have a chair, I kind of have to do this a little different way. You're tensing up way too much. There you go. Good. And usually you'll get a little audible pop, which we got on him. So look this way again for me. Look this way. I'll try to do this side too, actually. Let your shoulder drop. Okay. We got a little one on there too. Okay, how do you feel?
Good.
Super excited. Okay, so that is my neck protocol. If someone wants to just get their neck adjusted, I'll do that. But if people want like the muscle work, that's usually the process I go through. And then sometimes too, we'll follow up with some strengthening type exercises, because when it has to do with a lot of neck type patients, pretty much everyone needs stability exercises for the neck, because we're all just so like, I saw like this kid at the gym today, like literally like this on his phone, and I'm like, when you're 50, you're gonna be hurting. So clean up your posture, folks. But that is mostly what people need: a little muscle work, a little stability stuff, and you're good to go. So this is gonna be the end of the video. Thanks for checking it out, and I'll see you guys in the next one.
I wanna be like, yo.